Dear students, today we are going to study about antithyroid drugs. In this session, we will study about the classification of the drugs, their mechanism of action, adverse reactions, preparations, and therapeutic uses of these drugs. So, let us start with antithyroid drugs. These are the drugs which are used in hyperthyroidism. Hyperthyroidism. These are used in order to control the excessive secretion of thyroid hormones. So these are the drugs which are used to control excessive secretion of thyroid hormones. Now coming to the classification of antithyroid drugs. Classification. In general, we have categorized antithyroid drugs into four main categories. Number first is the thiourea derivatives. Thiourea derivatives. In this category, we have drugs like propyl thiouracil. Next is methamazole. Next is carbimazole. These three drugs come under the category thiourea derivatives. Next group of drugs is ionic inhibitors. In this group of drugs, we have potassium thiocyanate. And potassium perchlorate. Next group of drugs is iodides. In this we have sodium iodide and potassium iodide. And Lugol's iodine. Next we have fourth is radioactive iodine. In this we have iodine 131. This is a radioactive isotope of iodine. Now let us study about thiourea derivatives. First we will study about their mechanism of action. These drugs act by inhibiting the synthesis of thyroxine hormones. Number first, they cause inhibition of inhibition of peroxidase enzyme. Peroxidase enzyme means we earlier studied in the synthesis of thyroxine, there is a step in which the iodide ion negative gets oxidized into neutral iodine. That means anionic iodine gets converted into the atomic iodine by means of an oxidation reaction which is catalyzed by peroxidase enzyme. Peroxidase enzyme. These drugs cause inhibition of this very enzyme, hence stops this reaction. They cause inhibition of peroxidase enzyme, which inhibits the conversion of I negative into neutral iodine, which results in the inhibition of the synthesis of thyroxine hormone. This was the first step. Next step we know in the synthesis of thyroxine hormone, there is incorporation of iodine into tyrosyl residues. These group of drugs cause inhibition of this step. That is, they inhibit the iodine from getting combined with the tyrosine, which results in the synthesis of thyroxine. Hence, these drugs cause the inhibition of the synthesis of the thyroxine hormone, with which they perform antithyroid effects. Now, studying about the absorption of these drugs. These drugs are well absorbed on oral administration. Oral administration. They are absorbed within 20 to 30 minutes after oral administration. They are well absorbed on oral administration and are firmly bound to the plasma proteins. Firmly bound to plasma proteins, with which they do not cross placenta. Because they are bound to the plasma protein, hence are not available freely in the bloodstream to get crossed through the placenta. Next, their adverse reactions. Since these drugs have a number of adverse reactions like jaundice, headache, skin rashes, arthralgia. Arthralgia is the joint pain or joint stiffness. Adverse reactions also include like hypothyroidism. These are the common adverse reactions with these drugs. Next now, preparations. We have propyl thiouracil tablets, tablets, 300 to 600 milligrams daily. This is the preparation and dose daily. Another methimazole and carbimazole tablets. Methimazole and carbimazole tablets are present in the doses of 5 to 20 milligrams daily. 5 to 20 milligrams daily. This was about the preparation and doses. Now coming to the uses. They are used in the Graves' disease, that is hyperthyroidism disease. In this, they requires a long treatment for about 1 to 15 years. In this disease, we need a long treatment of about 1 to 15 years. Next is in hyperthyroidism in pregnancy. Hyperthyroidism in pregnancy. In pregnancy, there may be the condition where there is hyperthyroidism. In that case, we can give in pregnancy. In that case, we give propylthiouracil. That's the preferred drug in case of pregnancy. Propylthiouracil. So this was about the uses. For further details, we will study in next session. Thank you.